Hello, thank you very much. Sorry, there has been a difficulty connecting initially, but thank God we're here on live discussing survival social isolation as a consequence of the issues that have come upon us, which is the pandemic that has been here because of the COVID-19 pandemic. Now, clearly, we have lots of questions and give opportunity at some stage for people to interact and possibly write whatever comments you may have down there, and I would be able to respond to you. Now, March 2020, a man, Manu Dibango, a prominent jazz musician, was self-isolating at his own home, and obviously the story was he died. Obviously, this is not a secret news, and it's available to everyone to read online. And there are reports of many other people who died similarly while self-isolating. And so the real issues about self-isolation is not the fact that it's a bad thing. It's a practice that actually had a purpose to accomplish. And the major issues were that it aims at decreasing community transmission of the virus, and it also decreases clogging the health system, thereby allowing people to use resources of the health facilities with rational ability so that the system can cope. And thirdly, to reduce the overall mortality of the numbers of people dying. But we all know that the WHO has a definition of health, and one of which is a state of complete physical, mental, and social well-being, and not merely absence of disease or infirmity. This definition has not been altered since 1948. And that is quite an important part, that health is not just being alive. It has got more to do. And the quality of life is quite important. And so this broadcast, in some way, as I call it, is to discuss what are the issues that need to be in place to ensure that safe social isolation is embarked upon. Because I have had an experience that makes me feel that this is there's a gap in which this has got to be sorted, and it actually helps to improve the outcomes of people. The cases of death occurring during this isolation are because of progression of the disease itself, in other words, causing complication, sometimes depression, and then severe traumatic complications associated with being deprived of interactions with other people. The examples of prominent persons, like I mentioned, have been there with us. Some of you may know of people living in your communities that may have died while self-isolating, and simply because they do not recognize the warning signs that they should actually alert, or they are living in places that is too far from health facilities. And so, and by the time they actually trying to call for help, they are not able to access this help, and so they actually would die before they get some support and help in that sense. So there is a process that should be in place. We do know that there are places of isolation. One should be a person's own home, or another is a special isolation center, and then in some places there are hospitals. But how these are utilized is a very key measure, and it should just be individualized rather than to be imposed upon people. In other words, there were videos of people who were diagnosed with COVID-19, and authorities would go and kind of arrest the people, and kind of a stigmatization, and they will force them from isolation. And then they are made to stay in those places, and which can really, really be very, very gruesome experience, when indeed there are ways by which this can be organized, and it will provide the kind of care that people will not frown at. And so what is this individualized and comprehensive approach that I am looking at? For example, we do know that a person who has symptoms will need to be diagnosed first of all. Sometimes the test would return positive, and then the time the test would return negative. But sometimes a negative test does not mean that somebody doesn't have the COVID-19 virus, and so they may need some observation. In that sense, more tests need to be done, or some alternative diagnosis will be important at that point. So please remember, COVID-19 is not the only disease existing in the world, and the other causes of fevers and the kind of feeling that we have. In fact, most of the symptoms for those who live in Africa are almost like those of malaria fever. And so sometimes it might just be malaria, the regular malaria that is coming, that is manifesting as COVID-19. But if it is highly suspicious that it may be COVID-19 that you're actually exposed to, then it makes sense to actually monitor the things and repeat the test as appropriate. Now, when the test returns positive, what should be done? I've got an algorithm that I thought would be very relevant and people can actually go through to help them. Symptoms are present. So what do you do? A positive test will be divided into two forms. If the symptoms are mild, then of course there's a pathway they undertake. If there are severe symptoms, for example, there is fever, shortness of breathing, the person is not responding to conservative management, those are severe symptoms. So it goes through a pathway. Now, I will take the severe ones first. So if the symptoms are severe, shortness of breathing, recognizable, distraught, the person is not performing regular duties as they would normally do, hospital. There's no choice about that. And so that is the place the patient should go. Now, if you have mild symptoms, self-isolation is appropriate. But where should this happen? Now, there are three places. Your own home would give you, if there is enough rooms in your own home, meaning that you can actually stay in a separate room and the members of your family can be in another room where you do not have that kind of exposure, where you're actually risking them contacting the virus, then a person's own home would be relevant. There are cases I heard of professors, prominent people who should actually have self-isolated at their own homes and had to be taken to isolation centers and actually died there, which is quite unfortunate. And so isolate in your own home and you are able to recognize symptoms. Of course, not everyone who should self-isolate at home should be able to do that without ability to recognize the symptoms when they're getting worse. Mentioning them here would not help, because unless you have prior knowledge to recognize when the symptoms are getting worse, then you're not a candidate for self-isolation. You've got a support network, which means that when things are getting awful and on the other end of the line, you're interacting with your colleagues, they're able to recognize, oh, this is deterioration. Please, let's do something about it. You must have a good Wi-Fi and signal where you would be self-isolating in your own home, and there's organized access to healthcare, meaning that when you call the ambulance, they should be there to pick you up. You call a telephone number dedicated to ambulance service and you would be rushed into hospital. And or there is food supply, which is easily accessible, which you can order online and it would be brought to your door. Then that means that self-isolating in your own home will be relevant. Now, the second part is special facility. What happens? And if there's a special facility that the government has in place, built, which is very important for those who do not meet the criteria for isolating in their own homes. There's no enough rooms in your own home to do that, or you're not close to a hospital environment and there are no good video and media around at your own home, then it becomes important for you to actually be in a special facility. Regular monitoring and clinical staff should be present here, because that way it covers the gap of lack of knowledge of worsening symptoms, and therefore it's very helpful at that point. This can cope the debts people have and also provide avenues of interaction, which will then mean you will take control of the mental torture people have when they're self-isolating. The third one, which is the hospital isolation type version, is where maintenance of a special isolation facility in addition to is going to be an addition to the burden of the local health authority. That means that it's important that self-isolation is not the point here. You have got to go to a hospital for that. If your own place of isolation is not ideal and you've got severe symptoms, then there's no option for you. So definitely, these are components of care that would be very relevant to ensure that you obtain adequate care. Now, before I close this broadcast, there are 8 things I would bring to your mind as the person who is self-isolating. What should you be doing? Okay, rest. Rest is very important. For many of the people who get exposed to COVID-19, a lot of them have been overworking themselves severely. If you look at the demographics of people who have actually come down to this disease, there are people who are stressed. There are some who may not be that stressed, but look at the pattern of involvement, people who are working many hours and they're not resting enough, and so on and so forth. There's a lot of stress, even if because of illness, diabetes, hypertension, there's some stress relationship really about that. So when you have to be isolating, rest will help you recover some component of your health. And drink a lot of fluids and rest. Of course, that doesn't mean lie down as a potato couch. Just get up to do something that you can within your ability. Then to eat a balanced diet. Balanced in the sense that if you've never taken control and care of your food, please take control of it. Sit down in a place. Make sure that you are actually paying attention to every nutrient that gets into your dish. Adapt a lot of fish, proteins, a lot of vegetables and fruits, and multivitamin additions would be very, very relevant at that point. There are no specific food items that you should be restricting to, but make sure that your dish is balanced. Somebody says a full dish means a balanced dish. In other words, half of it would be vegetables and half of it would be some carbohydrates. Of course, some people don't like carbohydrates completely, which is still good for them. Thirdly, check specific things. Breaths. Check your breath, that when you take in a deep breath, it is efficient, effective breathing. One of the things I did was I took a deep breath, then I would hold it there to be sure that it's actually not going to stop suddenly. And then I recognized that there is good aeration within us, and that I'd hold it for about 5 seconds and then have to breathe out. Once you can achieve that, that's one good sign that you're not decompensating in that regards. But remember that it is not only about breathing. There are other organ damages that can occur. And so if you begin to find that your strength is failing you much more than you would normally have your strength, then that is a sign of deterioration and you need to do something about that. Then talk to people, talk to loved ones, talk to your family through the telephone, take a temperature, take your pulse rate if you have that ability. And then there are pulse oximeters, something that are put on the fingers or earlobes that is able to actually pick up if there is some changes in the amount of oxygen entering your system. At that point, it becomes very important to then alert the health authorities or loved ones that things are changing fast, and anything that can be done at that moment would be very, very important for your health. Number 5, meditate. Time is to think about a future, think about positive things that are good whatsoever, then things that are lovely whatsoever, things that are of good repute. Think on them. Remove your mind from destructive thoughts. It is very difficult at that point to actually think about, because you've read so much on social media, you've heard so much that's in the news, and the anticipation of doom is a very realistic anticipation, and it can be really, really, really worrying. However, your positive thoughts will actually help you through the process. Meditate and think. Number 6, exercise. Within the limit of your strength, try and stretch yourself, but not beyond your ability. The important thing about exercise is that the disease comes with increased clotting propensity. In other words, if you stay too long without really exercising your muscles, then you are more likely to develop clots, blood clots in the lungs and also in the legs. And those can kill more than even the disease itself. So try and do some bit of exercise, which you should have been doing anyway as a preventive measure. Number 7, cover your mouth and nose and don't touch your eyes when you come out to meet if you are in contact with other people. Remember, this disease has variants as well. So even if you are in a facility where you are with other people, be careful that you do not get their own variant of the disease. And so mouth cover, face, and so on should be very important part of your care. The 8th one, which is the last one, is have a low threshold to seek for help. If you're feeling depressed, if you're feeling in any sense unhappy with how things are going, it is time to alert for attention. And that will end at stop. And comments here, someone's asking, okay, good analysis from our own. You've had, okay, there's a voice there. That's very good. Thank you very much for that comment. I'm grateful for that. I will stop here, and I will try and post the transcript of this within the social media network or YouTube, and also in the blog post that shall come out of Worthy Works Medical Education. And you will be able to some of that comment and access this video as well. If you've got comments, please do not hesitate to get to me, and also subscribe so that you can get updates. Thank you very much for your time. Bye-bye.